Hi everyone, my name is Vikas. I'm a Caesar mentor or a portfolio pathway mentor. I've done many sessions and on detailed guidance of a general pediatric Caesar, and the videos are available on the channel or in the WhatsApp group. What I have not done so far is a guidance on a non-CCT portfolio pathway, which is the purpose of doing this video today. So I'll make it very simple and straightforward because lots of candidates ask me uh, through the social media channels to do a session on the non-CCT portfolio pathway guidance. So shall we start? Uh, so what is a non-CCT pathway? So simply non-CCT portfolio pathway or CSER is for pediatrics is basically the portfolio pathway for all the pediatric subspecialties. The CCT Caesar is general pediatrics and all other subspecialties like PICU, community, neonates, respiratory, GI. They are all non-CCT pathway. So the one of the main consideration is very important consideration is eligibility, and I have done a detailed video on that. But just to reiterate that, uh, to be eligible to apply for a non-CCT portfolio pathway, you either have to have a specialist qualification in that specialty achieved outside the UK, or you have to have a training experience of at least 6 months acquired in that specialty outside the UK. That is the eligibility to apply for the application, not to get successful in the application. So the next question, is it the easier than the CCT pathway or is it easier than the general pediatrics? The answer is no. So is it difficult than this CCT pathway? Again, the answer is no. So I would say it's more or less similar. There's no much difference. And what is the difference? I will tell you in the next slide. So coming to the evidence, which is the main thing, it was interesting to note that 60% of all your evidence is generic, irrespective of your specialty, which means that whatever specialty you are from, PICU, community, neonates, GI, respiratory, 60% of your evidence does not depend upon your specialty. Or in other words, you will have the similar or same evidence wherever you are working. And what does that evidence mean in terms of your application? These things: your appraisals, revalidation, rota, courses, conferences, CPD, research, audit, QIP, teaching, posters, presentation, rota management, incident reporting, handling complaints, colleague feedback, patient feedback, logbooks, clinic lists, rotas, governance, developing guidelines, assessing your juniors, witness statements, and your CV. So these kind of evidence you will have in all the specialties, wherever you are working. So that's why it's generics, and you can see that it's uh, almost 60%. I would say more than that. So 40% evidence is specific to your specialty. I mean, and what is that? That is mainly your work-based assessments, your portfolio work-based assessments, your mini-CAG, CBD, ACAT, HAT, DOC. I have done a detailed guidance on that in the general pediatric session, and it is available on the channel and other WhatsApp group as well to watch the videos. So the work-based assessment, you will orient them or modify them according to your specialty. For example, if you're working in general pediatrics, your work-based assessments will be around the general pediatric problems. If you're working in PICU, it will be around the the PICU thing. So at all that will depend upon your specialty curriculum. So that's where the main difference lies. What else? MDT meetings that will be different in different specialties. For example, if you are working in neonates, it will be on discharge planning meeting, or for extreme preterm neonate, or if, for example, if you are working in the community, it will be case conferences or child protection conferences. If you are working in neurology, there will be neuroradiology meetings. So these will be different depending upon your specialties. Procedures, of course, again depend upon your specialty. For general pediatrics, they are different. Four are mandatory and rest of them are optional: IV line, airway management, UVC, lumbar puncture, and there are many more. And of course, if you're working in neonates, you probably need more procedures. Some of the specialties the procedures are not that important. For example, community pediatrics. Then what else is different is safeguarding. So this again is important in some specialties, but not so in other specialties. For example, gastro, neuro, respiratory. So that is the main thing. To The reason of showing you this is to give an awareness that the non-CCT application is not very different from the CCT application. So more than half of your evidence is generic, and it does not depend which specialty you are working. You only have to slightly orient it towards that specialty. Okay, so the learning outcomes in a non-CCT specialty, so which we used to call domains. So all the non-CCT specialties like community peds, NICU, PICU, pediatric gastro, respiratory, etc., they have 4 domains instead of 11 domains, which we have in general pediatrics. Now, again, some people think that because there are fewer domains to provide the evidence for in non-CCT specialty, so it may be easier than that. That's not the case. These 4 domains are actually the generic domains by the GMC Good Medical Practice. You can have a look online. And these domains are: number one, professional knowledge and skills; number two, safety and quality; number three, communication, teamwork, and partnership; and number four, maintaining trust. Now, these domains actually are, if you concentrate, if you look from a deeper perspective, they are similar to domains in general pediatrics. The 11 domains in general peds: professional knowledge, communication procedures, patient management, health promotion, safety, quality improvement, research, and safeguarding and teaching and training. So they are similar to that. So domain one of non-CCT Caesar is similar to what we do in domain 1, 4, 5, 10, and 11. Now I don't want to go into the details. You can have a look in the other videos in general pediatrics, which are available on the YouTube channel. Then domain 2 is safety and quality, which is equivalent to domain 7, 8, 9 of general pediatrics, the quality improvement, patient safety, and safeguarding. And domain 3, which is communication, teamwork, and partnership, is equivalent to domain 2 and 6, which is communication and leadership in general pediatrics. And domain 4 is maintaining trust, like your uh, you know honesty, integrity, discrimination, equality, diversity, all these things, and they are equivalent to domain 1, 2, and 7 in your general pediatrics. So there's nothing different. They are similar to general pediatrics. All you have to do is to modify them according to your specialty. Even then, more than half of the evidence is generic, which means it's usually uh, the generic skills like leadership, management, revalidation, safety, equality, all that. Okay, so what evidence you can provide for professional knowledge and skills? Actually, so 70% of the evidence will come in domain 1, and that will include your appraisals, revalidation, work-based assessments, So I have written here under brackets full breadth of your curriculum. So you have to read your curriculum. So this is the main thing which will be you know, differ according to your specialty. Then what else will come here? Your rotas, logbooks, your CPD, all the courses and conferences you have done, research, teaching and training, governance, and your CV. So details of all these things are available in the other videos if you can see. What evidence will come in domain 2? You know, the incidence reporting and how to respond to incidences and complaints, the DATIC system in phase or whatever your hospital software is, duty of candor, audit, QI, safeguarding, health promotions. Now, again, I'm not going to go into the details because they are all available already in the videos I have done. Domain 3 is communication, teamwork, and partnership. Self-explanatory, you know what communication is, you know what teamwork is, and you know what partnership is. It's explained in details in the general pediatric videos available everywhere in the WhatsApp channel, on the WhatsApp groups, and my YouTube channel. So you can put here your details of your MDTs, discussion of correspondence, handover assessment tool, your leadership assessment like ACATs, leader CBDs, your management skills like rota management and all that, multi-source feedback, 360 feedback, root cause analysis, patient feedback, all these things will come here. Maintaining trust again is an the non-clinical skills you have, like how good a doctor you are, your honest, integrity, honesty, integrity, your fairness in financial dealings, clinical excellence, all these kind of things. So, in summary, just remember three main points. One is the non-CCT pathway is more or less same as the CCT pathway. It's not very much different, so there's no need to make it complicated. The very important thing to consider is eligibility before you start your application, and I have already mentioned the details. And more than half of the evidence you submit in any application is generic and does not depend upon your specialty, does not vary with your specialty, like your CV, appraisal, revalidation, and blah 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 blah, which I've already mentioned. So that's all about the non-CCT specialty. If you have any queries about this video or any other video or any one-to-one mentorship, you can comment on the video, or you can email me on this address. Thank you very much. I wish you all the best.